Hi everyone, good morning. We will allow a couple of minutes for others to join the session and then we will begin the session promptly at 10 a.m. Thanks for joining. Okay, so am I audible? Srinivas, Soumya, can you confirm?
Yes, Madhuri, you're audible.
Okay, thank you guys. So since the majority of the participants have joined, we will go ahead and begin the session. First of all, a very good morning to everyone and very warm welcome to today's session hosted by AAPC Hyderabad local chapter. It's a pleasure to see all participants from across different organizations and locations come together for this session hosted by the AAPC. Before we begin, let me take a moment to introduce myself. I am Srimadhuri Katoju. I have been associated with the AAPC Hyderabad local chapter for over 5 years, and I bring more than 14 years of experience in the healthcare and medical coding domain. I am deeply passionate about operations, quality, compliance, and continuous learning. And I strongly believe in growing together as a professional community. I am really excited to be your host for today's session and to connect with all of you. Even though we are meeting virtually, what truly stands out is our shared commitment to learning, growing, and staying updated in the healthcare industry. Your presence here reflects that dedication, and we sincerely appreciate you taking time from your busy schedule to be part of today's session. What makes this gathering so valuable is a mix of experience we have, from experienced professionals to those just starting their journey, from coders, SMEs, and auditors to team leads and aspiring experts. Each one of you adds value to this community. Today's session is not just about listening, it's about gaining practical insights, reflecting on our work, and taking away something meaningful that we can apply in our day to day roles related to medical decision making. Now, it's my privilege to introduce our esteemed speaker for today's session. She is Pudota Saumya. Saumya brings with her over 10 years of rich and diverse experience in healthcare revenue cycle and medical coding domain. Throughout her career, she has demonstrated exceptional expertise in areas such as coding E&M, quality assurance, denial management, and process improvement, making her a valuable contributor to the healthcare industry. She has constantly shown a strong commitment to accuracy, regulatory adherence, and continuous learning, which are critical pillars to our profession. Her hands on experience across multiple specialties and her ability to navigate complex coding scenarios have helped organizations achieve better compliance standards and improve operational efficiency. Apart from her professional achievements, Soumya is also passionate about knowledge sharing and mentoring her team members and enhance their coding skills and stay updated with evolving industry guidelines. Her practical insights and real world examples make her sessions both insightful and highly relatable. Today, she is here to share her knowledge and expertise on medical decision making, which I am sure will provide us with valuable takeaways that we can apply in our day to day work. Let us take this opportunity to actively engage, learn, and make the most of her expertise. Please join me welcoming Soumya. Soumya, you can start the session.
Yeah, thank you, Madhuri. A very good morning to everybody and the whole team. Happy to see we have a lot of members over here. It's very great to see everybody over here, and I appreciate your time to be part of this webinar where you can gain a very great knowledge. So appreciate your time, guys. So let me introduce myself before starting this webinar. So everybody are aware, and already Madhuri have given like intro of me. So everybody are aware of my name, but still, so this is Hudota Saumya, and I am carrying 10 years of experience into this medical coding field in tackling with the ENM, IPOP, and multi-speciality things. And I'm very passionate about the sharing knowledge and focusing on the updated things. And moreover, like I feel the most strength of me is learning the things very quickly and cascading that on a timely basis. So this is all about me. Madhuri, I hope we can just go ahead and start it, right?
Please share your screen. We are good to start, Soumya.
Okay, thank you. Just give me a confirmation, Madhuri. Is the screen is up?
Yes, it is visible.
Okay, thanks for the confirmation. So team, here, today's webinar, we're gonna discuss about medical decision making. So how expertised we are should be in related to the medical decision making and related to all of the services, like all of the E&M services, or else where the E&M services will be performed and should be like coded. So on those basis, we will be having a like a deep dive discussion in today. So before just going ahead, I have a request to the whole team, like what are the things you are supposed to do and what are the things you're not supposed to do till throughout the time where you guys are on the webinar. So please ensure that no distractions throughout this webinar. Be attentive during the session. And this session is being recorded, and moreover the question and answer round at the end of the session will be provided. And if not, if we are exceeding the time, you can also submit your queries in the chat box and that will be answered on timely basis. We have objectives over here, like we're gonna have a introduction to evaluation and management in related to the MDM part. And what is a coder role in understanding MDM table, applying the root cause analysis on MDM elements, and promote the complaints in assigning levels, followed by few of the examples for your better understanding. So before pitching into the exact topic of today's webinar, I just want some of the information from you guys. Like here we have multiple people, like belongs to multiple specialities, or else we have the we may have the people who are attending for the first time for the webinar, or else exposing yourself for the first time for this topic, or else you are completely new to this topic, or else we may have some freshers as well. So for that, I just want some information, like you can drop it in the chat box as well, no issues on that. So what type of, if you guys are experienced persons into the E&M, so just give me a information like what type of E&M exposure you guys are having, whether you are having a E&M exposure of IP or else OP, whatever it is. You just drop it out in the chat box very quickly so that I can have an understanding like what is the crowd here over here, whether it is an experienced crowd or whether it is a fresher crowd. So just take a few seconds of time and drop your answers in the, drop your responses in the chat box, like what's your exposure into, whether it's into the IP or else OP. And I request Madhuri just to let me know like what is the responses we are getting into the chat box.
Sure, Soumya. Let me check. So, Soumya, here we have a mix of both IP and OP experienced coders in the group.
Okay,
And
great.
we do have freshers to E&M.
Freshers also. Okay,
Yeah.
great. Yeah, okay. Okay, guys, thank you. It's good for your response. Fine. So here, to put it more precise and to put it more clear, here today I gonna discuss about the evaluation and management, which is related to the MDM part, whereas it's not the topic where I gonna discuss what is exactly about the evaluation and management. Okay, so try to understand the concept. So first of all, I'll just give you a brief about the evaluation and management, and then I'll be pitching into the like MDM concept. So here, evaluation and management is, first of all, this is a cognitive service. Cognitive service in the sense like understanding the process and like treating the patient. So here, these services will be rendered by some of the physicians or else some other health qualified professionals. They will be diagnosing and they will be treating the illness or else injury of the patient. So this is what the evaluation and management means. So to put it in a simple terminology where everybody can understand, here, like, see, once we will be visiting a hospital and we will be conveying our condition or else the state of the condition to the provider, stating as doctor, I have so and so headache or else I have so and so stomach pain from so many days and I'm experiencing other symptoms like this. So what I'm supposed to do it? So provider, either he will be examining you or else he will be ordering some labs or else he will be giving some medications or else he will be giving some instructions to be followed. Don't eat spicy food or else take some medication. So or else relax yourself. You will be get cured. It will be get cured. So this is what actually happens, right? So evaluating the patient condition and doing the management. So this is known as the evaluation and management. So coming back to the MDM part. So here, in order to quote the levels from the MDM part, the CPT ranges are 99202 to 99499. This is the range of the CPTs. So here, this will be representing the services provided by a physician and or other health qualified professional. As the name E&M indicates, these medical codes apply to visits and the services that involving evaluating the patient, managing health. So here, where the E&M services will be included. So here, E&M services will be included in the office, outpatient visits, hospital visits, home services, preventive services, some hospital inpatient, observations, prolonged services as well. So along with these of the services, E&M are also codable and these are the inclusive services. MDM for E&M coding. So here, generally, there are 4 types of MDM for E&M coding. That means 4 types of MDM means 4 levels or else 4 stages. Okay, 4 levels for E&M coding. Those are straightforward, low, moderate, and high. So here, the MDM concept does not apply to office or outpatient visit, which is the code is 99211. So this 99211 concept, so this is not applicable in the MDM table. Why? Because this is the services which will be rendered by the physicians who are like by the nurse practitioners or else the NPPs. So where the physician intervention will not be included. So that's the reason MDM will not be applicable for 99211. And any an emergency department code as well as 99281. So this is no more existing. So here, both of which may not require the presence of a physician or other health qualified care professional as per the descriptors. So here we have key components to code E&M. So again, understand the concept over here. History of the present illness, physical examination, MDM. Okay, so the key components, the 3 key components to code the E&M are history of the present illness, physical examination, MDM. So earlier we used to have these 3 key components are the major components which will be contributing towards the level pickuping. But now we have a changes, that is MDM or else total time is enough to code the level. So we just need to have the history like HPI, that means the history of present illness, and the physical examination will be having in the medical record. So whereas the whole and sole factor to give the level, assign the proper level is MDM or total time, medical decision making or else total time. So we'll have a deep dive in that. So we have in the MDM, we have 3 elements. That is the number and complexity of problems addressed during the encounter, the amount and or complexity of data to be reviewed and analyzed, sorry, the risk of complications and or morbidity or mortality of patient management. So here, first of all, what does the number and complexity of problems addressed during the encounter? This means, to put it in the simple terminology that everybody can understand over here, is by which problem or else which type of problem or else what, by which state of the problem or else by how many problems the patient is visiting the hospital. That is known as the problems addressed. The complexity means what is the state of the problem, whether the problem is stable or else the problem is not stable. What is that? That is known as the complexity of the problem. And amount and data to be reviewed and analyzed. So here in this, see, when a patient is visiting the hospital and conveying that what the patient is been experiencing, so provider will be doing some labs. He will be ordering some lab or else he will be reviewing the lab results. So that is known as the data to be reviewed and analyzed. And the third one, the risk of complications and or morbidity or mortality of patient management. That means to whatever the condition patient is coming with, for that, what is the management? That means what is the treatment provider is rendering to the patient? That means providing to the patient. And the complications which are related to that treatment. So that's known as the risk of complications and or morbidity or mortality of patient management. So these are the three elements of MDM table, and based on these elements, we will be choosing the level of the CPT. So this is just the brief about the MDM table for the each level. So here we have the levels: straightforward, low complexity, moderate complexity, high complexity. These are the levels of MDM. Here, the first one, number of diagnosis or problems addressed. For straightforward, what would be the complexity of problems should be addressed? It should be in a minimal, and amount and data to be reviewed, that should be minimal or none. Risk of complications and or morbidity or mortality, it should be minimal. And related to low complexity, when low complexity, what should be the number of diagnosis? It should be limited. Data should be limited and risk should be low. For the moderate complexity, number of diagnoses should be multiple, and data should be moderate, and risk should be moderate. And last but not the least, high complexity. So high complexity, the diagnosis should be extensive, data should be extensive, and moreover, the risk should be high. So this is what this minimal, limited, multiple, extensive, these things will be assigned from the MDM each element. So that one we're gonna have a deep dive in the upcoming slides. So first of all, before pitching into the MDM table exactly, first and the foremost thing what we are supposed to know is the type of the problem and the state of the problem. Okay, type of the problem, that means by which type of problem or else with which type of problem patient is like visiting the physician. So types of the problem is, it could be an acute problem which will be it's a curable, or else it could be a chronic problem where patient is experiencing from long time, and these are the types of the problem. So this is very much important and it will be playing a major role while assigning the levels from the MDM table. So it is very, very important to everybody to know what is the type of the problem and what is the state of the problem. Then only understanding the MDM elements, it will be pretty clear. So first, acute problem. So acute problem is nothing but, see here, let's break down what an acute problem is in the medical decision making. And then we'll be looking into some of the clear examples. So here the definition is, acute problem is a new or else a short-term medical issue that develops suddenly and often requires prompt evaluation and treatment. Evaluation or else treatment. So that means the acute problem, it's a sudden onset. It's or else it's a very new problem, or else it's a sudden onset problem, and it will be like like for few days it will be, and then it's a curable problem. Remember, acute problem is a curable problem. See, it is not a chronic problem. That means it's not a long lasting problem or else long standing problem, and usually it has a clear onset. Acute problem can range from self-limited problems as well. Self-limited problem is nothing but which does not require the provider intervention, whereas and self-intervention is also not required. Self-intervention is nothing but the self-care. Even the self-care is also not required, where that will be the self-limited problem is it will be cured naturally without the provider intervention or else self-intervention. So the acute problem can range from the self-limited problems to potentially life-threatening, which requires urgent intervention. So acute problems can be termed or else can be causing a life-threatening condition as well. It depends upon how like what is the condition of the patient, or else what is the state of that acute problem. So here we have some of the acute problems, like viral upper respiratory infection, acute sinusitis, or else minor ankle sprain. These are some of the acute problems. So these are short-term, often resolving with supportive care and minimal risk. So when this acute problem can be termed as a moderate risk. So like when acute asthma exacerbation is there, which requiring some inhaler adjustment. That means the medication adjustment, where this condition is acute only. Acute means, like as I said earlier, which is a curable condition. It's a curable condition. It will be lasting for a short period of time, but still it requires some treatment adjustment. So that means it is being exacerbated. It's not being stable. It's not being calm. It's being exacerbated. So that's the reason the treatment adjustment is required. And other scenario is acute knee injury after a fall, which requiring imaging to rule out the fracture. To know the etiology of that knee injury, provider will be doing some additional workup plan. So that is known as ordering some labs to rule out what is the etiology of that symptom. Urinary tract infection, which needing antibiotics. So by giving the antibiotics only, that UTI will be get treated. If not, it will management, but not immediately life-threatening conditions. These are not immediate, these will not cause an immediate life-threatening condition, but still what it requires is additional intervention of the provider, and moreover, this may require some treatment adjustments. And other scenario is when this acute problem can create a high risk. Chest pain suspicious for acute coronary syndrome, stroke symptoms like sudden weakness or slurred speech, acute appendicitis requiring surgical evaluation. So this involves significant risk of morbidity or mortality, requires extensive data to be reviewed, and moreover, often urgent intervention of the provider. So in short, acute problems are the new short-term conditions. Their impact on the medical decision making depends on how serious they are. How serious they are is, that means whether they are creating a low risk or else moderate risk or else the high risk. That means the state of the condition and how much data is needed to evaluate them, and what is the risk of the complications which are involved in the condition type. So this is the brief information about the acute problem. So if anybody are having any of the perception like acute problem means, okay, so as we have people who are having exposure for the ENM and IP and OP also, right? So if anybody are having any of the perception like acute problem means, okay, it might be termed for the low level only, it won't create a moderate risk to the patient. No, acute problem also will be creating a high risk, and sometimes it might create a life threatening condition also to the patient. So all the time what we are supposed to look into the documentation, or else we are supposed to analyze is what is the state of the condition, whether that acute problem is being stable, or else that acute problem requires some adjustments, treatment adjustments, or else some additional interventions from the provider, like ordering some labs or performing some labs and then doing some treatments, and or else adding some of the treatments like this. So we just need to look into the condition state. So now it's a time for you to uh, drop your answers in the chat box. So here we have a poll question here. A 45-year-old patient presents with sudden shortness of breath, chest pain, and low oxygen saturation. Upon the examination, patient was diagnosed as a tachycardic and anxious. So this is a question. So what should be your answer is, what is the most appropriate immediate next step in the medical decision making? That means what for this patient, what should be the appropriate immediate treatment need to be given? So here you have options: order an ECG to rule out myocardial infarction, administer oxygen and stabilize the patient, schedule an outpatient follow-up visit, prescribe oral antibiotics. So now it's your turn to answer to this poll questions.
Okay, good. So Soumya, we started receiving the responses,
Okay.
and majority of the people, they are responding both A and B.
A and B.
We
Okay.
have 50% crowd responded it as A and 50% responded as B.
Okay. So shall we go and reveal it, or else we need to wait?
Yeah, we will wait for a couple of minutes, then
Yeah, sure.
you can reveal the answer. So we can reveal the response now. We can reveal the answer now.
So here the answer is administered oxygen and stabilize the patient condition. See here, what is the question? First of all, patient is having a sudden shortness of breath, SOB, and chest pain, and moreover, patient is having a low oxygen saturation. So first of all, we need to stabilize the patient. First, since the patient is having a low O2 saturation, we can't go ahead and perform the labs. First, we need to stabilize the patient, and then the treatment can be rendered. So appreciated your responses, guys. So the answer is administered oxygen and stabilize the patient. And the second type of problem, that is chronic problem. Chronic problem, it is a medical condition that is long-standing, persistent, or recurring in a state. It typically lasts months to years and often requires ongoing care management rather than a one-time treatment. The chronic problems may be stable, that means like well controlled, or else unstable, like poorly controlled, worsening, or with complications. So here, to put it simple, Chronic problems, these are the problems which are just manageable by changing the treatment or else addition of treatment, but these are not the curable conditions. Acute problem is a curable condition. Chronic problem is a just manageable condition, which is not a curable condition. And when the stable chronic problem, which will be like termed for or is qualified for the low level, that the low risk, that is, for examples like hypertension controlled with medications, diabetes with stable blood sugar levels, osteoarthritis managed with lifestyle and mild like medications. So these are like those things. That means any of the chronic condition which is stable by the lifestyle or else by ongoing treatment, whatever it is. So that means the condition is not being worsened. Condition is not being worsened means the condition related symptoms, whatever are there, so those are not bothering the patient, and that will be termed as a stable condition. So these are the conditions are long term but currently under control, which requires the routine caring. The routine care or is just the routine follow-ups or is just the routine monitoring is enough. And other scenario, when these chronic problems will be creating a moderate risk. For example, asthma with occasional exacerbation needing inhaler adjustment. That means the treatment adjustment. Chronic kidney disease stage 3 requiring lab monitoring. Depression managed with medications but needing dose adjustments. So here, these requires ongoing management and periodic changes in the therapy with a moderate risk of complications. So this is other scenario where chronic problem will be creating a moderate risk. And what is the scenario when we can term or else when these chronic problems will be qualifying for the high risk is when a patient is having congestive heart failure with frequent hospitalizations, uncontrolled diabetes with complications like patient is having diabetes along with neuropathy or else along with the retinopathy, and metastatic cancer requiring the chemotherapy sessions. So these conditions carry significant risk of morbidity and mortality, requiring complex data to be reviewed and often involving high-risk management decisions, high-risk treatment decisions. So to put it in the short, these chronic problems are long-term conditions that requires ongoing monitoring and management, and their impact on the medical decision making depends on whether they are stable, unstable, and the risk associated with the treatment what has been rendered. So this is the second type of the chronic problem, the second type of the problem, acute problem and the chronic problem. So again, other poll question for you. A 65-year-old patient with CKD stage 3 has worsening lab values and uncontrolled blood pressure. So here patient is having a CKD stage 3 patient with having a worsening lab results, and moreover patient is having uncontrolled blood pressure. So what is the most appropriate management step we can do? Ignore lab changes, optimize blood pressure control and monitor kidney function, stop all medications, immediate kidney transplant referral. So it's your turn to pitch into and drop your answers in the chat box.
So we don't have any mixed responses here for this question. So they are responding it as B. We will give couple of minutes to them. Then you can explain the rationale to them, Soumya.
Sure.
We can explain the rationale now.
Okay.
Yeah.
So here the answer is optimize blood pressure control and monitor kidney functioning to slow progression. So here what it is mentioned, patient with CKD stage 3 is having worsening labs. So, and moreover, the blood pressure, the hypertension is uncontrolled. So first what we need to do, we need to stabilize the blood pressure, and whatever the lab results are there, so based on that, we need to monitor the kidney function. So that is the thing what we are supposed to perform here. Optimize blood pressure control and monitor the kidney function. So I hope most of the people have selected this B as the option. So it's very great and appreciated things for your response, guys. Great. Now, other parameter in related to understanding the MDM table, which is which will be playing a crucial role. That is understanding the state of the problem. State of the problem is nothing but whether it is a stable problem or else whether it is a worsening state, whether it is in a exhibition state. What is the condition state? So, stable problem presenting. So first thing, we'll be just going step by step, stable, worsening, and exhibition. So we'll be going step by step. So stable problem, have to analyze whether the problem is qualifying for the stable condition or not. That means, see, here we have an example. A 55-year-old male with a history of hypertension and currently taking lisinopril 10 mg daily. The blood pressure today is 124/78. Now, there is no new symptoms, no medication side effects. Labs from last visit were normal. So here, see, the hypertension it's a chronic condition, but still by taking the lisinopril, patient condition is being normalized. It's being improved. Or you can consider it's being improved or else it's being stable where it's not worsening. And by the using of the medication, patient is not having any additional symptoms or else no side effects of the medication. So here the rationale, hypertension is long-standing but currently controlled with the medication usage. So to conclude it, this encounter qualifies a low-level problem presenting because the chronic condition is stable and moreover controlled due to the current medication usage, and no further or else no new interventions are required in the current visit. So that is the reason it will be considered as a stable problem presenting. So to put it in the simple and short, a stable condition means the chronic problem is well controlled, not worsening, and does not require the routine monitoring only. So this is known as the stable problem. Next, worsening or unstable problem presenting. See, a 48-year-old female with known type 2 diabetes, previously controlled on metformin. Today's visit report fatigue, increased thirst, frequent urination. The lab results HbA1c increased from 7.0, which is in the last visit, and in today's visits, it's of 9.2. And upon the examination, provider have concluded as mild neuropathy symptoms in feet. So here this is a chronic condition, and in the current visit, it is worsening. Diabetes is a long-standing but has become uncontrolled, evidenced by rising the HbA1c and new symptoms. See, in the previous visit, the HbA1c values are 7.0. But in the current visit, it is 9.2. And in the previous, by using the metformin, patient condition is stable. But in the current visit, patient is experiencing fatigue and thirst, increase in the thirst, and moreover, the frequent urination. That means along with the condition, patient is having other symptoms also, which are bothering the patient. Here, we are supposed to term this condition as an unstable condition. Or else other synonym for this is worsening, not controlled. So here, this encounter qualifies as a moderate problem presenting because the chronic condition is worsening, which causing new symptoms like fatigue, increased thirst, and frequent urination. In a short, a worsening condition means a chronic problem that was previously stable is now poorly controlled and showing other complications, which increases the complexity of the problem presenting. So, to put it in the simple things, either it is an acute problem or else the chronic problem. Whatever the related symptoms or else additional symptoms which has been mentioned, and if it is reported by the patient that I am experiencing so and so other conditions or so and so other symptoms along with the diabetes or else hypertension or arthritis or whatever the condition, that means we are supposed to analyze that this is not a stable condition, where this is a worsening or uncontrolled condition. Third scenario for the state of the problem, exacerbation problem presenting. So before pitching into this one, we'll just know what up. Oh, okay, fine. So we'll just complete this one and then we'll have other scenario. See, exacerbation. See, 35-year-old male with a history of asthma reports worsening SOB, shortness of breath, wheezing, and cough for 15 days after using rescue inhaler more frequently. But symptoms still persist without any improvement. And upon the examination, audible wheezing, mild tachypnea, oxygen saturation is 92%. So here, exacerbation, a flare-up or else worsening of the chronic condition. Here, this is the asthma, this is a condition, and moreover, beyond the baseline control. That means, here, if you see what it is mentioned, cough for 15 days after using inhaler. That means, after undergoing the treatment for particular period, but still patient is experiencing the same thing. There is no improvement, there is no stabilization of the condition. Patient could not see any progress after undergoing the treatment. Still, the patient condition remains same. That's known as the exacerbation of the problem presenting. So now I just want to give you a short example for the people who are having the prior exposure. So you may have a doubt like exacerbation problem presenting will be supporting for the moderate level, and moreover the worsening problem also will be supporting for the moderate level. So what is the use or else what is the difference to know between the worsening state and the exacerbation problem? Simple. The worsening state is what we have saw earlier. It is not controlled and like some medication adjustment, or else patient it is saying previously it was well controlled, but now some symptoms has been erased. But here, upon undergoing the treatment also, previously it was worsened. Okay, that's the reason treatment has been started to the patient. But after undergoing the treatment also, still the patient condition remains same. Then that is should be termed as a exacerbation condition. So now in particularly or else in detail, you guys will be knowing about what is the use. Now you guys have known the difference between worsening state and the exacerbation state. And in upcoming slides, you will be knowing what is the use of knowing the difference between worsening and exacerbation state. Okay. So now again, you have a poll question. So the question goes like this. A 68-year-old patient with a history of chronic heart failure presents with worsening shortness of breath, swelling in legs, and difficult lying flat at night. So what type of problem presenting it is? Whether it is a stable problem, whether it is a worsening problem, or whether it is a exacerbation problem. So you guys need to give your responses in the chat box. So go ahead.
Yeah, Soumya, here we have mixed responses, Soumya.
Okay.
50% C and 50% B responded like that.
Okay.
Some persons are responded like A also.
Oh, A also.
Yep.
Okay. So shall we wait for a few more minutes, or else we can just go ahead and reveal the answer?
Yes, we can reveal the answer.
Okay, great. So the answer is worsening problem. Why? Because see what it is mentioned. See, a keyword for you guys. If anybody, no issues whether you are a freshers or exposing for a new thing for the first time, or as having a zero knowledge, whatever it is. First thing is, if we are reading the question, the 50% of answer will be lying in the question itself. See what it is mentioned. A 68-year-old patient with a history of chronic heart failure presented with worsening SOB. That means the condition is still ongoing. Okay, so here itself it is mentioned as worsening shortness of breath, swelling in legs, and difficult lying flat at night. So related to this chronic heart failure, along with that, patient is having some additional symptoms which are bothering the patient. Okay, so along with that condition, if patient is having some additional symptoms and bothering the patient, that means that condition is unstable condition or else uncontrolled condition. That's the reason it will be termed as a worsening problem. Okay, why it is not a stable problem is, I hope everybody should be understand by this. Why? Because it's not being calmed down. Patient is getting bothered by this additional symptoms. And why it is not exacerbation problem, we'll be looking into the next thing. Other one. A 70-year-old patient with chronic heart failure reports worsening shortness of breath, leg swelling, and difficult lying flat post undergoing treatment from past 1 week. Okay, post undergoing treatment from past a week. Now, what type of problem presenting it is, whether it is a stable problem, whether it is a worsening problem, or else whether it is an exacerbation problem. Give your answers. But read the question properly, guys. The same thing is documented here. The things have been changed is upon undergoing the treatment from past a week, but still patient is having these conditions and symptoms. So now what type of problem presenting will it be supportive? Give your answers. Okay, so did we receive the answers? Can Madhuri or Srinivas can just give me the confirmation on that? Madhuri, can I just get some info, please? Okay, fine. So I'll just go ahead and reveal the answer for this. It's a exacerbation problem. Why? Because here, upon undergoing the treatment also, still, though although it's a worsened condition, but for that only patient have been undergone a treatment, but still patient is experiencing the same. Patient condition remains same without minimal improvement. So that's the reason it will be considered as a exacerbation problem. So now I hope you guys are pretty clear on the difference between the worsening problem and the exacerbation problem. Worsening problem, previously it's controlled and now the symptoms are being worsened in the current visit or else in the current encounter. Exacerbation problem, already the state of the problem is worsening. Upon undergoing some treatment, still the condition remains same with a minimal improvement, without the minimal improvement, and the conditions are persist. The symptoms are persist. So that should be considered as a exacerbation problem. And here, this is the major part for you guys, and please listen carefully of each and every element. Okay, so first of all, this is like a medical decision making for like, which is a governing factor and which is employed for the code selection based upon the E&M services what has been performed. So here we have the key elements. Already I have given explanation. So we'll be having the levels: low, moderate, straightforward, low, moderate, high. And moreover, number and complexity of problems addressed, what type and what state of the problem, by which patient is visiting the hospital, elements like amount and or complexity of data to be reviewed and analyzed. That means here, as I said, provider will be ordering the labs, or else he will be reviewing the lab results, or else he will be like discussing with the other external physicians, or else he will be independently interpretate the results what that test are being stated. So these are the things, that means to get the etiology of the condition more clearly, or else
Yeah.
to yes.
Am I audible? Sorry for the interruption.
Yes,
Actually,
please.
here something I think network issue is going on. Your screen is not visible, Soumya.
Okay.
Sharing your screen, reshare your
Yeah,
screen.
I'll reshare it. Just allow me a moment, guys. Some technical glitch was going on. Just allow me a moment.
I think Soumya, we can see your screen and we can hear you. I think apologies for the technical issue. Not able to respond to the questions actually.
It's
Uh,
okay. It's okay. No issues on that.
so, am I audible now? Soumya,
Yes,
is
you
that
are
okay?
pretty clear. Yes, you are audible.
Great. Please continue. Yeah.
Okay. I hope this screen is up, right?
I'm not able to
Not
see your screen.
Is it with everybody? I just reshaped the screen. Now, just can I get a confirmation whether it's up or not?
No, Samya, it is not visible. Someone removed me from the meeting. Sorry, I couldn't able to connect. Now your screen is not visible, Soumya.
Okay, just a minute. Now, is it?
No, Soumya.
Just let me know once it's up.
No. So not visible for few of them, but few are responding. They can able to see the screen. Prasad, can you confirm? Are you able to see the screen? Like, is the screen visible for you? Samya, do one thing. Disconnect from the call. Join again. I'll make you as a presenter. Then we will see.
Yeah.
Yeah. So please allow us couple of minutes. There is some network issue from the speaker side. She is rejoining the session. Then we will make her presenter soon. Give us couple of minutes. Thank you for your patience.
Am I audible now, Srimadri?
Yeah, you are audible now. Can you make Soumya as a co-organizer, Prasad?
Yeah, I'm trying. What is her ID? Can you please do that? I'm unable to do. Again, same.
I did it, Madhuri. I need a co-organizer. Hello.
Yes, yes, Srinivas, you're audible.
Oh, yeah.
Can you please do that?
Yeah, I did it.
Yeah.
Now am I audible? Madhuri,
Yes,
can
Madhuri.
you just... Yes. Okay.
Yes, Madhuri, you're audible.
Now is the screen up?
No, Madhuri. Am I audible, Madhuri?
Yes, yes.
Soumya, are you sharing the screen again? Srinivas, am I audible? Yeah, now screen is up.
Yeah. Screen is visible and now you're audible, Prasad.
Yep. Screen is up, Soumya.
Thanks for the confirmation. And my serious apology for this, guys. Don't know what's the technical issue actually, but serious apology for this. And please try to understand this technical glitch. And once again, sorry for that. So, pitching back to the topic without any delay. So here, So we have discussed on the amount and or complexity of data to be reviewed and analyzed, and then coming into the risk of complications and or morbidity or mortality of patient management. So here, risk of the complications of patient management, that means this risk, whatever the risk will be there, that is related to the patient management. So many of the people will be having a perception stating as risk table means it will be related to the patient condition. No, risk table, that means risk of the complications are related to the patient management. That means whatever the treatment has been given to the patient, related to that treatment, if any complications are there, yes or no. That is what mean by risk of complications and or morbidity or mortality. So this is the brief of the three elements here. In order to pick the level, what we require is 2 by 3 criteria. 2 by 3 criteria means either we require, so I'll just put it in a simple terminology like column A, column B, or column C. Number of problem presentings, data to be reviewed, or a risk. So either we require column A, B, AC, BC, whatever it is. So 2 by 3 elements should met in order to code a MDM level. So no need to look into the all the three parameters. Like we just all the three elements, problem presenting should met, data should be met, and management also should be met in a same level. No need. Any two column information is enough to assign appropriate ENM level. So we'll be going level wise. So first level is straightforward. Straightforward means what type of reason for visit it should be, with which type of problems patient coming to hospital, that's so that it will be qualifying for the straightforward level. So that means examples like one self-limited or minor problem. So people who are exposing yourself for the first time, so let me make you understand how to read the MDM table first, which is very important and crucial point. First of all, how to read this elements is one self-limited problem, two or more self-limited problems. Many people are not aware that they will be just looking like, or else like a overlooking will be happen, like self-limited or minor problem, self-limited or minor problem, one stable chronic illness, or else like acute illness. But before that one, a criteria is there in order to qualify that self-limited, in order to qualify that problem presenting. What is the criteria is the numbers, one self-limited or else one minor problem. This is what the reason for visit should be there, so that it will be qualifying for the minimal level. That means the straightforward level. So self-limited problems, as I said earlier, like the problems which will be curing naturally without the self-intervention or else the provider intervention. And the minor problems as well, like which requires or else which will be having a minimal risk morbidity conditions, like patient is coming for the suture removal, or else patient is coming for the wound dressing, or else patient is having a common cold, or else patient is having a insect bite. So these are the type of the problem presentings which will be qualifying for self-limited or minor problems. So related to the data table. So data table, minimal or else none. It could be minimal, that means one data point can be, or else none. And related to the risk complications. Minimal risk of morbidity from additional diagnostic testing or else treatment. That means provider can do a management which is like very self-limited management. That means provider will be giving a care instructions, what to be followed and what not to be followed. The care instructions like a do's and don'ts, those things will be given, so that it will be qualifying for the straightforward or else minimal level. Next, low level. So for low level, we have three type of problem presentings which will be qualifying. That is, first one is two or more self-limited or minor problems, one stable chronic illness,
one acute uncomplicated illness or injury. So here again, you guys will be having already you guys are having exposure from the earlier slides, like what is a stable problem, what is a worsening problem, what is a acute problem, what is a chronic problem. So that by undergoing this elements, you guys will be having a overall view, and you guys will be understanding it easily, and you can analyze it, or else you can correlate it. Okay, stable chronic problem means patient is having a diabetes patient, and which is like a non-insulin dependent, or else patient is having some cataract problem, or else patient is having some benign prostate hyperplasia. So like this, these conditions are stable, and that will be qualifying as a stable chronic illness. Other one, one acute uncomplicated illness or injury. So acute, and again acute, or else like illness or injury, any of the condition or else any injury. See, any of the acute condition means patient is having some acute spray, like a leg sprain is there, so which is an injury, or else patient is having a acute asthma, or else patient is having acute sinusitis. So this is a uncomplicated problem presentings. So these are type of the problem presentings which will be supporting for the low level problems. Two or more self-limited or else two minor problems, one stable chronic illness, or else one acute uncomplicated illness, or else one acute uncomplicated injury. These are the types of the problem presentings which will be qualifying for low level. Now, pitching into the data points which required for the low level. So here, if you have a look over here, we are having a category information from the data table. So category informations, we have multiple categories. That is the category 1, test and documents. Category 2, assessment requiring an independent historians. So here assessment from these categories must met the requirement of at least 1 out of 2. That means from either the information should be there from the category 1, or else the information should be there from the category 2. Any one category information should be there. So here, if you see and have a look at category 1, test and documents, any combination of two from the following. So you have here the bullet points, right? Review of prior external notes from each unique source, review of results of each unique test, ordering of each unique test. So here, review of prior external note, or else provider will be reviewing the external note. That means external note, to put it more precise, one physician will be ordering the test, and the current physician who is there, that will be reviewing those results, test results. So that's known as the external note review. So the current physician who is reviewing that will be termed as a external note review. Why? Because he haven't ordered that test. Other physician have ordered the test earlier, and the current physician to whom the patient have visited, that physician is reviewing the results of that earlier test. So that will be termed as a external note for the current physician. Hence, it will be finalized and it will be concluded as external note review. And so provider can review the results. So where he will be ordering the test and he will be reviewing the results. That is one. And other one is ordering each unique test. So provider can order each unique test, like provider can order the X-ray, provider can order the pathology test like CBC, CMP, or else provider can order like ECG, EKG. So he can order this and he can review the results. So like that, any 2 points should met: review of prior external note, or else review of results, or else ordering of test. Any 2 bullet points from this 3 should document in the medical record in order to qualify the test and documents. This is one. And pitching into the second category, assessment requiring an independent historians. So to put it in simple thing, this is also known as the caveat rule. Caveat rule is nothing but obtaining the history from the family members or else the caregivers or else the surrogates who have been accompanied the patient to the hospital. Why? Because patient might be in a state like patient is having some medical disorder, so that patient could not explain their history, or else patient could not explain or else convey what type of condition patient is undergoing. So at that time, related to the patient condition, provider will be obtaining the patient information from the family members or else caregivers or whoever have been accompanied them to the hospital. So at this time, the complete history will be documented in the medical record. That will be considered as a caveat rule. That means the history will be considered as a complete history. So that's known as the assessment requiring an independent historians. So to qualify the low level from the data table, either test and documents should be documented. If not, an assessment requiring independent historians should be documented. So and among these things, any one category information is enough to qualify the low level from the data. So now pitching into the risk of complications, which will be qualifying for low level. So here, low risk of morbidity from additional diagnostic testing or treatment. That means what type of treatments which will be qualifying for low level. The first and the foremost and very familiar thing for everybody, or like most of the people, is over the counter drugs, OTC medications. Over the counter drugs means we don't require the prescription of the provider. We can go and we can get the medication by our own. Those are known as the over the counter drugs. Prescribe giving the OTC medications, referring the patient to physical therapy, occupational therapy, like this, giving the referrals, or else doing a superficial dressings, or else performing like a minor surgery, where like minimal invasive surgeries. So these are the things which will be, or else you can consider as giving the hydrations. So these are the things which will be coming under the low risk of management. And from this, any two column information should met in order to give a low level. Next, another level, moderate level. So for moderate level, we have one or more chronic illness with exacerbation, progression, or side effects of the treatment. Two or more stable chronic illnesses, one undiagnosed new problem with uncertain prognosis, one acute illness with systemic symptoms, or else one acute complicated injury. So here, one or more chronic illness with one or more chronic illness with exacerbation, progression, or side effects of the treatment. So here, by this time, you are supposed to have an overall view what is meant by the exacerbation. So here, you can consider as uncontrolled diabetes after using the metformin, or else COPD which is in an exacerbation state, or else patient is having asthma side effects, some AC inhibitors will be causing some cough. So that by using that AC inhibitors, patient is experiencing cough. So that's the reason provider have asked the patient to discontinue those medications. Why? Because patient is having some side effects. So provider have asked to discontinue the usage of that medication. So that will be qualifying. So here, in order to understand this problem presenting, first and the foremost thing what you are supposed to know is to know how to read this problem presenting and correlate from the medical record. So here, what it is mentioned, one or more chronic illness with exacerbation, progression, or side effects of the treatment, right? That means either we need to have the chronic condition where the etiology is not clear, or else where the state of the condition is in a exacerbation state, or else for that particular chronic condition, whatever the treatment is undergoing, due to that treatment, patient should have some side effects. Okay, so if you just have the side effects, consider that patient is having a cough and nausea from past 2 days. This information won't qualify for this problem presenting. Why? Because we need to have for which the current condition patient is using that medication. We need to have the information. So the chronic condition name should be there, and along with that, either it should be in a exacerbation condition, or else it should be in a where the patient is having side effects due to the treatment for that condition. That is how we are supposed to analyze this problem presenting one or more chronic illness with exacerbation, progression, or side effects of the treatment. Next, two or more stable chronic illness. Consider that a patient is having arthritis and patient is having diabetes, which is in a stable condition. Still, it will be supporting for moderate level. And one undiagnosed new problem with uncertain prognosis. See, to understand this one easily, all the time the reason for visit, have to analyze it, or else have to conclude that this is the reason for visit, which is qualifying for the undiagnosed new problem. That means all the time the reason for visit will be a symptom only. Okay, consider that patient is visiting a hospital with some abdominal pain, and it is not prognosed. That means it is not been diagnosed. And in order to know the etiology of that symptom, provider will be ordering some labs. What is the reason for that abdominal pain? So that to know the etiology of that condition, that symptom, provider will be ordering the labs. So that's known as the undiagnosed problem. And the lab results should not be there in the current visits. If the results are there, simple, the condition has been diagnosed, and it won't be termed as an undiagnosed problem. Okay, so the results of that lab, what has been performed in the current dose, should not be there, so that it will be considered as an undiagnosed problem. So here the provider perception will be like, this undiagnosed problem, this abdominal pain may create a moderate or a severe risk to the patient life. So that would be the provider perception. So he is supposed to do some of the additional workup plan by ordering some labs and to know the etiology of that symptom. So all the time the reason for visit will be as a symptom only, not as a condition. So that's known as an undiagnosed new problem with uncertain prognosis. And acute illness with systemic symptoms, like you can say like colitis or else pneumonitis, along with some systemic symptoms. Like the systemic symptoms may not be a general symptoms, but maybe belongs to single system. For example, like fever, fatigue, dizziness. These are the systemic symptoms. That means the acute illness will be belong to one organ system, and the systemic symptoms will be belong to a different organ system, where these systemic symptoms will be creating an impact on the patient bodily functioning. So these are known as the systemic symptoms. So in order to finalize it, the systemic symptoms you should not consider as the acute illness common symptoms. Okay, whatever the acute illness is there, for that whatever the correlated symptoms or else inclusive symptoms are there, that should not be considered as a systemic symptoms. Why? Because systemic symptoms should be belong to different organ system, and those should be create an impact on the patient bodily functioning. Next, acute complicated injury. So acute complicated injury means like an injury which requires more treatment options, because the injury is extensive, and moreover it is associated with the risk of morbidities. Okay, so here more treatment options should be, like the intervention should be provided. That's the reason it is termed as a complicated injury. So these are the problem presentings which are supportive. Any one problem presenting is there, yes, this will be termed for the moderate level. Along with that, some additional information also I want to give it to you. But here is, in the medical record, if you find out a one chronic problem which is in a worsening state, yes, that still qualifies for the moderate problem presenting. Here you don't have, but still consider as a additional heads up or as additional information. One chronic state, one chronic worsening condition, that will be qualifying for the moderate level problem presenting. So now we'll be switching into the test data table. Here we have three category information. So above we have two category information, which is test and documents, assessment requiring independent historians. So if you have just a keen observation over here, test and documents or independent historians, that means these two categories has been clubbed as a one category for the moderate level. And it was termed as any three combination of the any combination of three from the following is required. The same thing, whatever is documented over here, this has been documented in the moderate level as well. Prior external note, review results, ordering test, assessment requiring independent historians. So any three data points should be there in order to assign moderate level from the first category. Either you can have like two labs which was reviewed and independent historians is there, yes, still it is supporting. Why? Because we require three data points. If not, other category information, independent interpretation of the test. So independent interpretation of the test is nothing but, see, independent interpretation of a test performed by other physician or other qualified healthcare professional, not separately reported. So here that means the test will be performed by other physician, and this test interpretation is nothing but provider will be stating what the test results are showing, that will be cascaded to the patient. So here, when the interpretation will be done by the current physician, whoever have been performed that lab or else who have been performed that x-ray, whatever the test, that physician won't be present. So without the presence of the performing physician, the current physician will be reviewing and he will be interpreting the results he himself, like independently to the patient. That's known as independent interpretation of the test. And we do have other category, that is discussion of management or test interpretation. Discussion of management of test interpretation is, see, this will be done with the external physician or else with other qualified healthcare professional, like appropriate source, like will not supportly report it. That means, see, when any of the physician is not clear on what the test results are stating or else what appropriate treatment need to be given to the patient, the patient information, like the patient condition, about the patient condition or else about the patient test results, the current physician will be discussing with the external physician. So those can be belongs to the same specialty or else those can be belong to the different specialty based upon the type of the condition or else based upon the test results. So the current physician will be discussing with the external physician or else with other physician in order to conclude what the test results are stating or else what exact treatment need to be given to the patient. So that is known as the discussion of management or test interpretation. So from this, any one category information should be documented in the medical record, which will be qualifying a moderate data reviewed. Now into the risk of complications for the moderate level. So here, first thing is prescription drug management, which is for the like for most of the people, which is very familiar word, prescription drug. Prescription drug is nothing but the provider will be giving a prescription. Without the provider prescription, we cannot get that medication that require a provider prescription, so that only we can get that. That's the reason it is termed as a prescribed drug. So we will be having some of the scenarios where to consider the prescription drug management. Like if provider in the medical records, see, consider that provider is stating that to either he will be initiating a new drug, or else he will be asking the patient to continue the drug, or else he will be asking the patient to discontinue the drug. If not, provider will be increasing or decreasing the dosage of the drug based upon the patient condition. So these are all the scenarios where we are supposed to consider that this is a scenario where prescription drug management is supporting: initiating a new drug, continuing, discontinuing, increasing or decreasing the dosage of the medications. These are all the things which will be comes under the parameter of prescription drug management. And decision regarding minor surgery with identified patient or procedure risk factors. So here I'll just put it as simple as it is. For example, consider that patient has been went for the dental physician, okay, for some dental extraction, and patient is already with a known severe allergy. Patient is already having a severe allergy, which can create a higher risk for the infection when the surgery has been performed. Okay, so that's known as the decision regarding a minor surgery, where the page either the risk factors can be related to the patient existing condition, or else the risk factors can be related to the treatment which was given to the patient. And decision regarding elective major surgery without identified patient or procedure risk factors. Any elective major surgery, see, so here major surgery without the risk factors, that means the surgery due to the patient condition or else due to the procedure which was performed, risk factor should not be there, and it should be a major surgery. And it elective means it's a pre-planned surgery. Okay, pre-planned surgery, and moreover the patient will be, in the other words, the patient will be choosing the method of the treatment. That means like provider will be conveying that this is a condition where it can be treated surgically or non-surgically. Okay, so based upon the patient convenience, since it's a pre-planned surgery, if it is a both options are there, based upon the patient convenience, patient will be choosing the method of the treatment either to undergo surgically or non-surgically. That's the other word called for the elective. It's a pre-planned surgery, and moreover patient will be choosing the method of the treatment. And the last but not the least, for the risk table which will be qualifying for the moderate level, is diagnosis or treatment significantly limited by social determinants of health. Social determination of health, that means simple, like it could be related to the patient socialized things, or else patient economy things, like provider will be prescribing some medications, but patient cannot afford the cost for that medication, either due to the patient unemployment, or else patient is a homeless, patient is not having a family, patient is living alone. So like this, these are the social determination of health. So from this, any two column information is required in order to code the moderate level. So now we are pitching into the high level. So here, for high level, what we require: one or more chronic illness with severe exacerbation, progression, or side effects of the treatment. So here, if you see, I have said earlier, like you guys will be knowing what is the use of knowing the difference between exacerbation and severe worsening and exacerbation in upcoming slides, right? You guys have already known the difference between worsening and exacerbation. But what is the use of knowing the difference between worsening and exacerbation is, if patient condition is exacerbated, yes, it will be qualifying for moderate level. But what if patient condition is severely exacerbated? It will be qualifying for high level. Now, you may come up with some doubt stating that like how am I supposed to know whether that is a severely exacerbated condition or else it's just a exacerbated condition? Simple. See, exacerbated condition is nothing but patient can tolerate the condition up to some extent, either by changing the medications or else adding new medications or else increasing the dosages, like doing additional interventions. But severe exacerbations means you can easily termed as patient cannot tolerate the conditions, where mostly the mortality rate might be coming into the picture. Mortality rate is nothing but the death rate. The severely exacerbated conditions, upon like all the time it will be like patient cannot treat, cannot tolerate that condition, where very much high risk of complications will be involved, and a high risk of treatment need to be, high level of treatment need to be rendered. So that is the use of knowing the difference between worsening and exacerbation. If the condition is severely exacerbated, yes, that will be supporting for the high level problem presenting. If the condition is exacerbated, then that will be supported for just moderate level. And other thing is the same thing, like side effects of the treatment for that severely exacerbated condition. Other one is one acute or chronic illness or injury that poses a threat to life or bodily functioning. So here we can just correlate like severe respiratory distress, severe rheumatoid arthritis, or else patient is having some pulmonary embolism, myocardial infarction, patient is having some psychiatric illness where patient is having some suicidal thoughts, or else creating a threat to others' life, creating a threat to he himself, or is creating a threat to others' life. So these are the acute and chronic illnesses which will be creating a threat to life or else the bodily function. So these are the problem presentings which will be qualifying for the high level. Next, we'll be pitching into the data table. So here for the moderate level, what we have saw, the same thing is there for the high level as well. Category 1, test and documents or independent historians, like any combination of three from the following, the same thing, independent interpretation of the test and the discussion of management or test interpretation. The categories remain same. Only the criteria is the requirement, I could say. Okay, so the requirement, the criteria is any two category information is required. See, for people who are having a prior exposure, if you guys have any of the perception stating that okay, three data points are there, chalo, I can give a moderate level. But and if we have five data points, or else if in the medical record if it is mentioned as a four data points are qualifying, yes, I can give high level. No, if you have 10 data points also, still that data table won't be supportive for high level. Why? Because the criteria here itself, it is stating two category information is mandatory. We need to have two category information, either category 1 2 or else 2 3 or else 3 1, whatever it is. Any two category information is required in order to code high level from the data table. Next, risk of complications and or morbidity or mortality of patient management, which will be qualifying for the high level. What are the elements we have here? Drug therapy requiring intensive monitoring for toxicity, decision regarding elective major surgery with identified patient risk factors or procedure, decision regarding emergency surgery, decision regarding hospitalization, and do not resuscitate or de-escalate care because of the poor prognosis. So these are the elements what will be supporting for the high level. So what do you mean by drug therapy requiring intensive monitoring for toxicity? See, consider that like patient is having some patient is undergoing some cancer treatment, okay, some therapies. So cancer treatment means obviously some radiation therapy or else a chemotherapist will be undergoing, right? So here some treatment will be rendered to the patient. So while giving the treatment, to in order to make sure that whatever the drug has been induced into the patient body, that means sending into the patient body, that should not create any toxicity, or else that should not create any adverse effects to the patient. So in order to overcome that, while inducing or else while the treatment is being ongoing, the close monitoring will be performed. And decision regarding elective major surgery, um, like with identified patient or processor risk factors. So here, this one we can term as a, like, consider that there is a patient with ophthalmic problem, and that ophthalmic problem, it can be acute or else it can be chronic, anything it else. So upon the examination here, provider is concluding that there is a high chances where patient might be become blindness or patient may lose her vision. So hence, with this, since it is an immediate intervention which need to be performed, so what provider will be confirming here is he will be doing a immediate surgery without any delay of 24 hours. That means within 24 hours, so and so surgery has to be performed so that patient won't be having so and so complications. So that is known as the elective major surgery. And moreover, here, either related to the patient condition or else related to the procedure which was performed, the risk factors will be inclusive. And decision regarding emergency major surgery, so either you can consider that patient met with some accident, or some CPR has been given, and the immediate surgery had to be performed, where the immediate intervention of the provider need to be performed. And decision regarding hospitalization. So here, first of all, we need to know what it should be documented in the medical record is first thing. So here the medical record should reflect what is the severity of the patient condition, or else, like, these are the factors such as patient is potentially not able to manage his or health conditions like by themselves, where patient requires the hospital level of care immediately. That's known as the decision regarding hospitalization. And the last but not the least, decision not to resuscitate or de-escalate care because of the poor prognosis. That means, see, here, patient whoever have been diagnosed with some chronic conditions, so here they cannot afford the treatment cost. Again, guys, please understand the difference between SDOH and the DNR. Do not resuscitate. So here, SDOH is nothing but social determination of health, is nothing but their patient cannot afford the medicine cost. That means the prescription cost. But here the DNR is where the patient cannot afford the treatment cost. So at that time, patient will be withdrawing all the treatment services. That means patient will be requesting the physician that do not provide me any further treatment. Why? Because I cannot afford the treatment cost. So, or else, other scenario also is there. Upon performing multiple treatments, the patient body will not be responding to the treatments. So there also the DNR will be applied. That means no further treatment will be rendered. So provider will be mentioning in these two scenarios, provider will be mentioning either patient is not willing to go ahead with the further treatment as patient cannot afford the treatment cost, or else patient is not responding for any treatment, hence no further treatment will be performed. So hence DNR is applied. So that is what meant by the DNR. So in order to code the high level, again the same thing, any 2-column information is required for coding the exact level for the high level. So this is the deep dive information about the MDM table what we have. So to precise it, any 2-column information is enough to code the appropriate level, straightforward, low, moderate, or high. So now we'll be having examples for each level over here. So here with a quick thing, we'll just go ahead. See, example for the straightforward level. A 25-year-old patient with allergies present with mild symptoms of sneezing. With mild symptoms of sneezing. The physician performs a basic physical examination, orders no test, and advice on the care instructions. Okay, so here the rationale goes. This is of the further straightforward level. Why? Because patient is having allergies, which is a straightforward condition, and the diagnosis is only one self-limited or else one minor problem is being addressed, and there is no data has been performed, and the risk of complications, the management includes only one care instructions about the medications, about the condition allergies, and there is no additional risk of the complications and or else morbidity or mortality which is associated with the treatments. Why? Because only the care instructions for that allergy has been given. So that's the reason it will be termed as a straightforward level. And for the low level, so here a 28-year-old with nasal congestion and facial pressure, mild headache for 5 days, no fever, no vision changes, no neurological defects. The past medical history is stating as it's a seasonal allergies, and the examination is stating as mild tenderness over maxillary sinus, otherwise normal. And the plan is to take the ibuprofen 200 mg daily once for 5 days. This is the plan which was executed by the provider to the patient condition. So the rationale goes like this. This is for the low level. Why? Because a single acute problem, that is acute sinusitis, is there, and no labs were reviewed. Only history and physical examination has been performed, and the risk and complications are minimal risk. Why? Because provider have given the OTC medications and no other prescription or else no other invasive procedures was performed. So that's the reason this will be qualifying for the low level. Next, qualifying for the moderate level. A 14-year-old boy present to clinic after falling while playing basketball. He reports knee pain, swelling, and difficult bearing weight. The physician reviews the patient history, performs a physical examination, and orders a knee X-ray to rule out the fracture. The X-ray shows no fracture, no dislocation, but there is a evidence of the soft tissue swelling. This is the scenario. So here, why it is qualifying for the moderate level is provider is suspecting there is a ligament tear, and he have performed the lab and he have reviewed it. What he is giving the plan is he have prescribed the non-steroidal anti-inflammatory drugs for the pain and swelling relief, and he have recommended some rest, ice compression, and elevation, that is of for the rise, and he provides some knee brace for the support and with a limited wear beating, and he have referred like for the orthopedic if the symptoms has been persist beyond 1 to 2 weeks, or else if the symptoms like knee swelling and knee paining or is difficult bearing weight, so if it is being worsened upon the duration, so the patient has to be visit the orthopedic. So this was the suggestion which was given. That's the reason it will be supporting for the moderate level. And for the high level, we have one more example. A 72-year-old established patient with a history of congenital heart failure, chronic kidney disease, and diabetes present with worsening shortness of breath, orthopnea, and leg swelling as well. So here, the physician spends total 50 minutes of face-to-face time on the day of this encounter or service. So here it is based upon the time. As I said earlier, like we will be coding these things, the MDM level based upon the time as well. So here, all the scenarios what we have saw above is based upon the MDM. Whereas here, the scenario other also is there. That is, we can code this level based upon the based upon the time factor. So the established patient is there, and moreover the time which was spent is 50 minutes. So it will be qualifying for the high level of the MDM based upon the time factor. So these are the examples. And now it's a time for the poll questions. Very quickly we'll be having a review of the poll questions. So here it's a time for everybody to be proactive and drop your questions in the chat box. See, a 20-year-old patient was seen for mild headache. The provider conducted an appropriate history and examination. The plan is provider have suggested the patient to be hydrated by intake of large number of fluids. So what would be the type of MDM? Whether it is a straightforward, low, moderate, or high? Just quick, give your answers. Read the question properly, guys.
Yeah, yes, Soumya. Here we are getting mixed answers, Soumya. Option A and option B.
Option A
Straightforward.
and option B.
Yeah.
Okay, great. So I'm revealing the answer. It's a straightforward level. Why it's a straightforward level? Here, patient is having a mild headache, which is a one minor problem. Okay, and provider conducted appropriate history examination, and what he is suggesting, he is not doing any management over here. He is just giving instructions like keep yourself hydrated by taking large amount of fluids. This is what the care instructions what provider is giving to the patient. That's the reason, which is related to the minimal risk. So that's the reason it will be termed as a straightforward level. Great, but still people who have given low level, still I appreciate your responses, but just to try to understand what the patient is been getting from the provider. Next poll question. An established patient is being seen in office for the evaluation of the skin tags. The patient state he has skin tags, he would like to have removed it. He state he has had these skin tags for many months. No other concerns are there. He is just having a skin tags from many months, but he don't have any other concerns. So upon the examination, provider have came to know that there is one skin tag on the neck and the other skin tag under the left arm. So totally two skin tags were there, and provider have given an explanation, detailed explanation to the about the removal of the skin tags. So patient have been agreed it, and the two skin tags has been removed. Okay, so here now what would be the level of MDM, whether it will be qualifying for straightforward, low, moderate or high? Which one? Patient is having two skin tags and provider have removed those two skin tags. No other concerns are there, no other complications are there. So which level it will qualify?
Yeah, Soumya. Here also we are getting mixed answers, Soumya. Option A and option B. And option C also. Some of the members mentioned. Yeah, Soumya, if you are speaking, your voice is not audible right now.
It's not audible, Soumya.
Yeah, your screen is visible, but voice is not audible.
Now?
Yeah, now it's clear.
Okay, thank you. So here, this is a low level. Why? Because the skin tax, which is like the procedure which was performed, the minimal invasive procedure which was here, it was performed with no complications. And this is not the procedure which will be creating a risk to the patient. So that's the reason it will be termed as a low level. So next question. Established patient is here for follow-up on hypertension, obesity, and chronic insomnia. Patient ran out of the medication from past a week, hence hypertension is worsened. That means for whatever the for hypertension, whatever the medication patient is using, those has been ran out of the patient is no more having that medications. So from a past week, patient is not been using the medication. So that's the reason patient hypertension was worsened. Okay. And Upon the examination, like assessment, what is the provider planning is blood pressure. He is stating as blood pressure is uncontrolled, and currently patient is using, previously that means patient used to use losatrin and the amlodipine, but due to the outage of the medications, patient is not being used from the past week. So what is the plan he have given? Patient is advised to continue monitoring the BP at home, and now again provider have prescribed losatrin 50 mg, amlodipine 5 mg for 2 weeks. This is the management which was given. One chronic uncontrolled condition with the RX management. This is what the scenario is. So now it's your time to respond over here, guys, whether it is a straightforward, low, moderate, or high.
Yeah, Soumya, max people are responded like C. Option C, they're choosing.
Okay.
Yeah, C is the
Great.
response.
C is the response. Okay, great. Appreciate your responses, guys, which is very accurate response I have got. It's a great thing and great understanding you guys are having. So that's a moderate level. And we have other one. A 60-year-old patient with heart failure present with severe shortness of breath, swelling, and elevated blood pressure. The physician reviews the patient's extensive medical history by performing appropriate physical examination. What is the plan? The physician orders multiple diagnostic tests, including echocardiogram and blood work as well. And he have adjusted the medications, and patient has been referred to emergency department for immediate evaluation. Patient is a 60-year-old patient and he is having a heart failure, and patient is having shortness of breath, elevated blood pressure, some swelling is there, and moreover, due to the patient age and the health condition, provider has been ordered multiple labs. He have changed the medications also, and he have referred the patient to emergency department for immediate evaluation. That means immediate treatment, next level of the treatment, patient has been referred to the emergency department. Now tell me what level of the MDM will be, straightforward, low, moderate, or high?
Yeah, Soumya, here all of them responded like option D, high level only.
Option D. Wow. Okay, so let's see what it is. Great. It's a high level. Good, guys. Good understanding and great response you have given. So this is all the information about the medical decision making, understanding the concept, understanding the state of the problem, understanding the type of the problem, so that it will be very easy to analyze with what type of problem presenting patient is coming to the hospital. And then we just need to correlate to the what is the additional workup plan. That means what is the data has been performed, or else what is the treatment has been given to the particular condition for the patient. So by just colliding all these things, we can easily analyze a level, whether it is a straightforward, low, moderate, or high. And other thing is, we just go ahead and code the level of the CPT by just based upon the total time. Whatever the total time provider have spent on the particular visit, based on that, we can just go ahead and code the appropriate ENM level. So this is the complete deep dive information about the medical decision making on picking the accurate ENM levels. So I thanks everybody for your time and valuable understanding and responding with your great understanding of this poll questions, and thanks to be a part of this webinar. I hope everybody have gained a knowledge on how to understand and analyze the medical decision making. Thank you, guys. Thanks a lot. So handovering back to Madhuri or Srinivas on this.
Yes, Soumya. Thank you for the info. And here there is some questions from attendees. So can you please look into the Q&A? Just escape.
Yeah, sure.
just stop your screen sharing and
Yeah, yes.
please look into the Q&A. So there is a first question from attendee Himabindu.
Yeah, orders were placed for 3 unique labs on the encounter, and there is no documentation whether they are performed or not. So claim history, there is no bill for labs. How can we consider the data points? So that is what. So in the history, we need to go back and check it over here. So in the MDM table itself, it is stating that either provider can order the labs, or else he can review the labs, or else he can review the external. So in the current documentation, if it is stating either in the, like, as 3 key components I have said, like history, examination, and MDM. So that means the assessment and plan. So in that, if you find out that provider have ordered so and so labs, so you can go ahead and consider based upon the what unique labs, how many unique labs he have ordered. So you can just go ahead and you can count that as a data point. And the other one.
And there is a question, scroll down once. There is a question,
Yeah.
other questions. So there is a question.
Record physical examination session not found. Have to identify ENM code. See, to put it more precise, in order to assign the ENM, we no need of physical examination. Physical examination is required in order to, it will be required in order to give appropriate, the ICD part, the more specific ICD part. Nothing you will be picking. You will be just knowing the state of the condition that you will be coming to know from the HPI. If you don't have the HPI and you don't have the physical examination also, then we can just not go ahead by reviewing that medical record. We just need to go to the protocol what we are supposed to follow it. And have to identify the acute problem with words of acute, which treatment and which treatment management, any key to identify acute problem. Okay, see, acute problem is nothing but which will be lasting for a few, like a short period of time. And moreover, you can easily analyze. See, few problems will be there. You can't get an exact thing that this is the acute list or this is the chronic list. See, problems, we just need to analyze the duration from when the patient is having that condition. Just based upon the duration, you can easily analyze whether that is a new problem or else whether that is a, whether that is an acute problem or whether that is a chronic problem. So this is the analysis, like based upon the duration, you can go ahead and conclude what type of problem presenting it is. And based on acute level ENM change, have to identify these are more acute or it's short-term acute. So that's what I have given you an explanation in the earlier slide before pitching into the MDM part. When an acute problem is there, we should not consider that it will be qualifying for the some particular level. It will be qualifying for the next higher level also based upon the state of the condition. That's the reason I have given you a clear explanation in order to analyze the state of the condition. Though that is an acute problem, the symptoms which are related to that condition, if those are being bothering or else those are being worsening, so that will be considered for the next high level of the problem in a perception stating that that will be creating a moderate risk to the patient. So based upon the state of the problem, the ENM level will be changing and you just need to identify what are the additional symptoms or else the condition related symptoms are bothering the patient or not. Whether those are stable or else whether those are bothering the patient or not. This is what you're supposed to analyze it.
Thank you, Soumya, for your responses. And there is so many questions from attendees end. However, there is no time to give the explanation for the questions. So right now, can you please submit that answers for the questions from the attendees, right?
Yeah, sure. I'll do that.
Thank you. Thank you so much for that response. And Srinivas, over to you, Srinivas.
Yeah.
Thank you. Thank you, Sama. So Soumya, we'll consolidate the questions and could you please give us the answers as Prasad said, and so that will be appreciated. So
Yeah, sure, we'll do that.
sure, sure. Thank you so much. So I'd like to, we are at the end of the session, and uh, on the behalf of local chapter Hyderabad, we'd like to thank speaker, a wonderful speaker, Udata Soumya. Very, very thankful to your presentation. Such a wonderful explanation, and there was an interaction between the users who are able to understand the MDM, from their own perspective, and you have given enough understanding of the different levels, and also such a wonderful presentation and interactive session. And I'd like to thank all the users who have joined, this webinar, who are very enthusiastic to learn about MDM. Thank you so much, and I'd like to finally thank a local chapter Hyderabad team, the president Adilakshmi ma'am, Madhuri, and Prasad and myself. So, overall, it's a wonderful session. Thank you so much for everyone for giving your time, and that's all from our end. And I would like to update you on the CEUs. We are going to uh, process the CEUs probably in the next 2 to 3 weeks time. And if at all, if you have any questions or any concerns related to CEUs, please reach out to our email ID or WhatsApp. We are available on the uh, LinkedIn as well. So with that, we are going to conclude the session. Thank you, everyone. Happy weekend. Thank you so much for your time on the Saturday morning. Thank you so much. Take care, everyone. Bye bye.
Thank you, Srinivas. Thank you. Thank you, Soumya.
Thank you, Soumya. Thank you.
Thank you, team. Thank you, everybody. Have a great weekend. Bye bye.